Your convenient meal delivery service might be making you seriously ill, and this latest CDC warning reveals just how dangerous our obsession with food convenience has become. The Centers for Disease Control and Prevention just dropped a bombshell food safety alert that should make every meal kit subscriber think twice about what's really in their refrigerator. Federal health officials are now investigating a troubling Salmonella outbreak that they've directly traced back to ready-to-eat home delivery meals manufactured by Metabolic Meals, and the details are more alarming than you might expect. But here's where it gets controversial. While we're all rushing to embrace the convenience of having meals delivered to our doorstep, are we actually putting our health at serious risk? CDC and public health officials across multiple states are currently investigating a widespread outbreak of salmonella infections that has been directly connected to specific home delivery meals produced by Metabolic Meals, federal health authorities announced this Friday. Their urgent message couldn't be clearer. Consumers must immediately stop consuming any affected Metabolic Meals products while our investigation continues. We're urging everyone to thoroughly check both their refrigerators and freezers for these dangerous products and either dispose of them immediately or reach out to the company for guidance. The shocking numbers behind this outbreak. As of the latest reports, this outbreak has already sickened at least 16 individuals spread across 10 different states, a clear indication of just how far-reaching this contamination has become. What's even more concerning is that out of the 15 people for whom detailed medical information is currently available, a staggering 7 individuals have required hospitalization. That's nearly half of all confirmed cases requiring serious medical intervention. The affected states paint a picture of nationwide distribution problems. Arkansas, California, Connecticut, Georgia, Illinois, Minnesota, Missouri, Texas, Washington, and Wisconsin have all reported confirmed illness cases. While health officials have confirmed that no deaths have been reported at this time, the hospitalization rate should raise serious questions about the severity of this contamination. And this is the part most people miss. When a meal delivery company can distribute contaminated food across 10 states simultaneously, it exposes fundamental flaws in our food safety oversight system. When contacted for comment, Metabolic Meals representatives have not yet provided a response to media inquiries. However, the CDC has confirmed that Metabolic Meals is actively collaborating with investigators and has proactively reached out to customers who purchased the specific meal types mentioned in this alert to directly inform them about the ongoing outbreak situation. The dangerous meals you need to identify immediately. According to federal investigators, customers who ordered and received any of the following Metabolic Meals products, specifically those delivered during the week of July 28, 2025, must not consume them under any circumstances. 4 cheese tortellini with pesto sauce and grilled chicken. This meal carries lot code 25199 and displays a best by date of August 7, 2025. Low-carb chicken teriyaki and vegetables. Look for lot code 25202 with a best by date of August 5, 2025. Black garlic ranch chicken tenders with roasted vegetables. This variety shows lot code 25205 and a best by date of August 8, 2025. Sliced top sirloin with roasted peanut sauce and summer vegetables. Check for lot code 25203 with a best by date of August 6, 2025. Beyond these specific meal varieties, health officials have identified additional concerning lot codes that consumers should be aware of. 25199, 25202, 25203, 25204, and 25205. If you find any meals with these lot numbers, regardless of the specific meal type, you should treat them as potentially contaminated. But here's what's really troubling. How did contaminated meals with so many different lot codes make it through quality control and into customers' homes? Understanding the salmonella threat. To truly grasp why this outbreak is so serious, you need to understand what we're actually dealing with when it comes to salmonella bacteria. These microscopic organisms are responsible for approximately 1.35 million infections across the United States every single year, with the vast majority of these cases directly linked to contaminated food sources, according to CDC data. People typically become infected with salmonella through two primary pathways, either by directly swallowing the bacteria through contaminated food or beverages, or by coming into contact with infected animals, animal waste, and environments where animals live and move around. What makes salmonella particularly concerning is its incredible diversity. Scientists have already identified more than 2,500 different types of salmonella bacteria, though fewer than 100 of these varieties are responsible for most human illnesses. Recognizing the warning signs, if you've consumed any of the potentially contaminated meals, you need to watch for specific symptoms that could indicate salmonella infection. Most people who become infected with salmonella will experience a constellation of uncomfortable and potentially dangerous symptoms, including severe abdominal pain, fever, persistent headaches, watery diarrhea that may contain blood or mucus, complete loss of appetite, nausea, and vomiting. The timing of these symptoms is crucial to understand. They typically begin appearing anywhere from 6 hours to 6 full days after the bacteria enters your system. For most healthy adults, these symptoms will resolve naturally without medical intervention after 4 to 7 days of illness. However, and this is critical, certain vulnerable populations face much more serious risks. Children under 5 years old, adults 65 and older, and individuals with compromised immune systems may develop severe complications that absolutely require professional medical treatment or even hospitalization. The bigger question nobody's asking. This outbreak raises uncomfortable questions about the entire meal delivery industry that most people aren't willing to discuss. When companies are mass-producing ready-to-eat meals and shipping them across state lines, are we creating the perfect conditions for widespread foodborne illness outbreaks? Are we trading convenience for safety? And more importantly, should we be placing this much trust in companies to handle our food safety when the consequences of failure can be hospitalization or worse? Here's what I want to know. Do you think the meal delivery industry has adequate safety oversight? Or are we essentially gambling with our health every time we order these convenient meals? Have you ever gotten sick from a meal delivery service? And if so, do you report it to health authorities? Share your thoughts in the comments below. I'm particularly interested in hearing from anyone who's had experience with metabolic meals or similar services. Do you think this outbreak will change how you approach meal delivery services? Or do you believe this is just an isolated incident that shouldn't impact our trust in the industry?